Hi, my name is Michaela Willis, and today I'm going to be assessing patient and scenario 3, and her name is Margie Colby, and she's a 25-year-old. This is her first time giving birth, and so the scenario was that after a low forceps delivery of a 9-pound, 2-ounce male birth, 45 minutes after the delivery, her vital signs were 100/60 for blood pressure, her pulse was 88, and respirations were 16. Her fundus was firm and at level of umbilicus. No clots were observed at that time. She had continuous trickle of red blood, red lochia, and no change in perineal edema. Ice pack was applied and peri pads were put underneath her and changed. The peri pads and chuck weight indicated that she had lost about 300 cc's of blood. This situation that I talked about, in my SBAR, I was talking about her background, her situation, her background, her assessment, and my recommendation. So in her situation, I discussed that she originally had a blood pressure of 100/60 and that dropped to 90/52. I also indicated that she had lost about 500 to 600 cc's of blood within that time period. She also had her heart rate increase from 88 to 110, and her vitals, her respirations went from 16 to 20. Her temperature was unknown, and I stated that I was concerned because the blood pressure was very low and less than 100 systolic, and she was losing a lot of blood. The problem likely was that she was dealing with a postpartum hemorrhage due to her copious amounts of blood loss as well as low blood pressure. My thoughts on the clinical scenario originally were I saw that she was losing a lot of blood and her blood pressure was dropping, so I immediately was concerned about the amount of blood she was losing and the short period of time. I believe that the temperature of the patient should have been added, as well as the mental status and whether they were alert and oriented. I also was unaware of her oxygen level and if she was on oxygen or not, had an oxygen tank or not. I was also not aware of her allergies, as these were not included, and I didn't know any current medications, any IVs, or what her code status was. I believe that these things should have been added. The unnecessary information that wasn't necessary to be on there was the information in the beginning with her being happy about being a new mother and planning to breastfeed. I didn't feel that this information was super necessary or pertinent to the situation. I believe that what should have been done differently was that more information should have been given, such as mental status, her background information, in order to fully assess the patient. The patient didn't really have much background information given, so it was kind of difficult to assess. It was kind of difficult to assess what the patient was dealing with or what issues the patient had. The patient's allergies were also unknown, and these patient's allergies, those are very important to note because it helps to understand which medications can be taken and given to her and which medications cannot be given to her. It would be a very serious situation if she was given a medication and the medications that she was allergic to hadn't been noted on her chart. And this would be a very serious situation because it could make her situation a lot worse. She was already losing a lot of blood and in a lot of probably pain, and her blood pressure was continuously dropping, and it was unknown whether or not she was allergic to anything. So this would have been a very important thing to note. The significance of this situation, I believe, was mostly portrayed in my SBAR. However, I think that the background information should have been better given so that this could have been more conveyed better. The evidence and situation was portrayed to the physician in the best possible way. The vitals are evidence to the severity of the blood loss and the situation. I stated that mental status was unknown, whether it was alert and oriented, and her skin was unclear of whether or not it was what the situation was with her skin. They did note that the fundus was firm and midline with the umbilicus, which is good. That's good to note. It was unclear whether or not the patient was on oxygen, and I stated in my assessment piece that the problem was likely a postpartum hemorrhage due to her blood loss and patient being unstable. I mentioned that the patient was getting worse, and I had done some research to ensure that this was what the possibility could be. I recommended that the patient should be given a blood transfusion, additional IV fluids, and given oxytocin to control bleeding. I would also ask the doctor how often they would like to get vitals checked and how often they would allow the blood loss to be checked. In this scenario, this patient definitely needed a blood transfusion because they were losing a lot of blood and they couldn't seem to keep blood in them, so it just kept losing blood. I also believe that IV fluids would help slow the amount of blood loss, and oxytocin is meant to help with after birth, slowing the amount of blood loss after a woman has been given birth. Oxytocin is also used to increase and induce labor, but after the baby is born, it helps to slow blood loss. The references that I used were aafp.org, and the website was about postpartum hemorrhage prevention and treatment. And the other reference that I used was Stanford Children's Health, and this website discussed what postpartum hemorrhages were and what the causes could be and what the symptoms were.